Why are my adenomyosis cramps getting worse? If you've been experiencing increasing pain during your periods, it can be confusing and frustrating. Adenomyosis is a condition where the tissue that normally lines the inside of your uterus starts growing into the muscular wall of the uterus. Over time, this invasion causes the walls of the uterus to thicken and sometimes enlarge, which can lead to more intense cramps and heavier bleeding. As the tissue grows deeper into the muscle, your uterus has to contract harder to shed the lining during your period, which can make cramps feel stronger and more painful. One of the main reasons your cramps might be worsening is because of this thickening of the uterine muscle, known as the myometrium. When the endometrial tissue invades the muscle, it causes it to become enlarged and more sensitive. This means your uterus contracts more forcefully during menstruation, leading to deeper, sharper pain that can feel more intense than typical menstrual cramps. The more the tissue grows, the more your uterus has to work, which can make the pain feel worse over time. Hormonal changes also play a big role. Elevated levels of estrogen, which are common in women with adenomyosis, can stimulate the growth of the ectopic endometrial tissue inside the muscle wall. This hormonal influence can increase inflammation and swelling, making your cramps more severe. Fluctuations in hormones during your cycle can also cause the tissue to become more reactive, heightening pain sensations. Inflammation is another key factor. The presence of endometrial tissue within the uterine muscle triggers a chronic inflammatory response. This inflammation sensitizes nerve endings in the area, making pain feel sharper and more persistent. Swelling and pressure from inflammation can also increase pelvic discomfort, contributing to the worsening of cramps. Some women with adenomyosis also show elevated levels of Ca125, a marker sometimes associated with inflammation in gynecologic conditions. Higher levels of this marker often correlate with more severe symptoms, including intense cramps. Additionally, as the condition progresses, the uterus tends to enlarge, which can cause ongoing pelvic pain even outside of your period. Progression over time is common in adenomyosis. The abnormal tissue continues to invade the muscle wall, and the uterus may enlarge further. This ongoing growth can lead to persistent pain that lasts beyond your period, making cramps feel worse and more difficult to manage. Factors like previous uterine surgeries or trauma, such as cesarean sections, may also contribute to increased severity or faster progression of symptoms. Lifestyle factors can influence inflammation and pain as well. Diets high in processed foods, saturated fats, or sugars may promote inflammation in the body, potentially worsening symptoms. Managing these factors, alongside medical treatment, can sometimes help reduce pain. From a fertility perspective, worsening cramps can be a sign that the condition is progressing, which may impact your chances of conceiving. Adenomyosis often coexists with endometriosis, another condition involving misplaced endometrial tissue, and both can cause significant pain and inflammation that interfere with reproductive health. If your cramps are getting worse, it is very important to see a healthcare provider. They can help confirm the diagnosis and discuss treatment options. These may include pain medications, hormonal therapies to regulate or suppress menstrual bleeding, or in some cases, surgical procedures to remove affected tissue or reduce uterine size. Managing inflammation and hormonal balance can help lessen pain and may improve your quality of life and fertility prospects. In summary, worsening adenomyosis cramps happen because of the ongoing invasion of endometrial tissue into the uterine muscle, hormonal influences that promote growth and inflammation, and structural changes in the uterus. All these factors combine to make your period pain more intense and longer lasting over time. Always consult a healthcare professional for personalized advice and effective management options.